Eric, as a pediatric gastroenterologist, do you think any of these recommendations are different for children? What would you tell parents who have children with IBD who are listening right now?
Yeah, so I mean, I don't think that they're all that different. I mean, we certainly would recommend treating the IBD as the number one priority. I think it's worth emphasizing again, and I know, Gil, you brought this up earlier, but it's worth emphasizing again that children and teens seem to get more mild disease, COVID-19, which is good news for the children and teens. So there was a study that just came out in the last couple of days in the journal Pediatrics, which many of you may have seen in the news actually this morning. But it looked at it was the largest study in children, 2,143 children diagnosed under the age of 18 with COVID-19 in China between January 16th and February 8th. So of those 2,143 children, 4% were asymptomatic, so they had no symptoms at all. 51% had mild illness. So that's symptoms of acute sort of upper respiratory tract infection that we call sort of fever, fatigue, muscle aches, cough, the usual kind of colds, flu type symptoms. 39% had moderate illness, which was more pneumonia and frequent fever and cough. And 6%, only 6% had critical illness where they needed hospitalization. Of those who had severe or critical illness, only 0.6% of the total 2,000 children had respiratory distress syndrome or multi-organ dysfunction, much, much, much lower than the adults. And only one child died of the 2,143. I think what's important to note is that infants did have a higher rate of serious illness, infants under 1 rather. 11% had more severe or critical illness. None of them died. Potentially because they don't have the same immune systems as children do. They don't have the same antibodies from the mothers yet to coronavirus because it's new. It is worth noting that so far the studies that have looked at pregnant women show that there's no transmission of coronavirus, of COVID-19 to a newborn through anything like amniotic fluid or the placenta or in breast milk. So that's all good news that as far as we know, small studies so far, but as far as we know, you can't catch COVID-19 from your mother who is pregnant. You can catch it if your mother is coughing.
Or child or adult. Like I can catch COVID from my mom.
Yes.
Or a newborn can catch it from the mom. Yeah.
Yeah, so we're hearing a lot of the audience, I think. But yes, of course, if your mother is sick, you can catch it from your mother. And you can catch it from the community as well if you're a child. So the other point to make is that I think there are some differences in treatment or how commonly we use certain treatments in children with IBD. So one of the main treatments that we use to induce remission in children with IBD is exclusive enteral nutrition. So that's formula feeds or tube feeds for kind of anywhere from 6 to 12 weeks exclusively, meaning no other solid foods. And that seems to induce remission, at least in children, as well as prednisone does. So if, for me as a pediatric gastroenterologist, if my choice was use prednisone or use tube feeds, I would absolutely recommend tube feeds. Now, that's only been shown to be effective in mild to moderate Crohn's in children. So, the severe, we'd still be looking at what Remo was saying earlier, biologics being the top choice. But it's worth a discussion with your physician as to whether or not the formula feeds may be an option for your child.